My name is Isel Jimenez Mejia, and I'm one of the front office administrators. A fun fact for me, I'm from Charlotte, North Carolina. We moved over here about 5 years ago due to my husband's work, and I'm happy to have made that move. I started the field after I graduated high school. One of the reasons that I started this field was because back then there was not a lot of bilinguals people in the field. There was not a lot of speakers as well. So I noticed that there was a lot of Spanish speakers that were, including my parents, were wanting to get into dentistry or wanting to get like a cleaning or work done, but they were not able to because there was not so many bilinguals or someone that could do the translation for them to go to the step into the office, call to make an appointment. So the first step was like for me to do was, you know, get the patients in and get the patients to be able to schedule that appointment. So that was very huge role for me when I first started. And then I started moving up and up, and that's how I am where I am today. I had a patient one time that had very anxiety. He had never went to the dentist before, and it was his first time coming in for a cleaning, which is just a simple procedure. So I explained to him one on one how we do things in office is if he has a question or if something's hurting or he doesn't feel comfortable with us doing something, he can always raise his right hand. So that really helped calm him, and he felt a little bit more in the comfort zone for him to do it. He completed his appointment and was able to move forward with treatment later on. One thing that's helped me connect with patients being a mom also is that with some moms with the same language barrier as well, they have difficult times having their children brush their teeth 2 times a day, morning and at night, and flossing. So sometimes I just connect with them and I give them some tips that works with me and my child and give them those ideas to them. And sometimes they have called me back or next time they come in for their cleanings and they've told me, "Oh, like the tip that you gave me last time when I was in, it really helped with my child. Thank you so much." And I get really good feedback on that whenever I speak to them and whenever they ask me a question about something related to that, I connect with them very well. One piece of advice I give to every patient, regardless of what they're coming in for, is sometimes it's either finances, sometimes it's anxiety, sometimes it's a lot of things or trauma that they've had in the past, but doing one thing at a time is better than doing nothing, is what I tell them most of the time. So that's one piece of advice I use for every patient. And it doesn't matter if we book out the appointment for a month or 2 months, but at least, getting in and doing that one step helps a lot for them to feel comfortable to come back in.